So in this video, I'm going to talk you through one of my favorite transformations. So this lovely lady came to me because she was concerned about looking quite tired. So her main areas of concern were around her eyes, and she also felt that the area around her mouth made her look a little bit more aged due to the fact that she had developed quite a few fine lines and wrinkles around that region. So the reason this is one of my favorite transformations is because this particular one was more of a restorative treatment, and we're not trying to enhance or change the way she looks. It's all just about restoring the lost volume that she has and making her feel a little bit better about herself and a bit more confident. So let's start with the upper area first, around her eyes. So the main thing to understand firstly is how this area changes with age. So the first thing that happens is around the eyes here, just underneath, we're losing a lot of bone volume. So because we're losing bone volume, the skin on top doesn't have as much to anchor on. So you can it starts looking a little bit more sunken, and the soft tissue above starts hollowing down here. And everything starts to look a little bit like it's sagging in this region. So what we did for that is just put a little bit of filler in that region here along these few locations that I'm pointing out on myself. We just put a bit of filler deep down onto the bone to help restore that lost volume. The other area that loses a lot of volume is this region here. So this is called our tear trough, or colloquially lots of people call this your under eye filler, but it's a very small area just here, and actually this area has no fat. So when you lose bone in that region, and you also lose collagen, elastin and hyaluronic acid in that region, the surface changes are a lot more apparent. So people will often notice that their eyes start looking more tired with age, and it's one of the first things that people will point out. And that's because this area can be really quite unforgiving. So we placed a small amount of filler that is specifically designed for that region in the tear trough zone as well. Another area that actually impacts the eye is just underneath in the medial cheek, or this mid-cheek compartment. So this area here loses a lot of fat, but it also loses a lot of bone. So the combination effect of that is the cheek dropping slightly, so you get a longer looking hollow around the eye, but also all of this skin doesn't have as much to anchor on, so it starts dropping and you begin getting these nose to mouth folds and folds from the corner of your mouth down to your chin as well. So by placing a bit of filler deep down onto the bone here to restore that lost volume, you can lift, and you can also help improve the tear trough indirectly, or the sunken hollows. So here you can see the area around her eyes and her cheeks looks really nicely restored, and it's not overly done, and it just looks very natural, and she looks like herself. Then we moved on to the lower part of her face. So we placed a bit of filler in her nose to mouth folds, very minimal because we don't want her to look over puffy in that region. We then placed a bit of filler from the corners of her mouth down to her chin. This helps tighten the jawline, also helps curl up the corners of the mouth that can actually start looking sad as you're getting older. And it just helped revolumize that region and help reduce the appearance of fine lines in that region. Her other main concern was the lines around her lips along this region here. They're called perioral lines, or smoker's lines. And these form because of a loss of collagen in the skin. So they start forming more creases on the skin. But also the muscle around the mouth is very active. I mean, it's used for eating, for speaking, for laughing, for smiling. It's used for so many things throughout life that actually you do then get quite a few lines that can form around the mouth. Along with this, the lip itself loses volume in terms of fat and hydration. So a combination approach was taken here with some filler in the lip to add back a bit of hydration and volume, but not to create super pouty, crazy lips. And we used a very, very, very thin filler in the skin area of the region around her mouth to help replenish those wrinkles and fine lines around her mouth too. What happens when you place filler in that skin region, or the dermal layer of your skin, is that it will stimulate your own body's collagen. So you'll intrinsically be improving the appearance of your fine lines as well in that region. So this patient was super duper happy with her subtle, natural and restorative results. She even had tears in her eyes afterwards, which was really quite sweet to see, and she felt that she looked less tired and she felt more confident too. These results can last anywhere between 12 to 24 months. And it's always important to have a very thorough consultation and for you to feel comfortable with your treatment plan before going ahead. So thank you for watching. I hope you found that useful. If you have any questions, please drop them down below and don't forget to like and subscribe.